be able to share that with more folks today.
Great, great, great.
Alrighty, yeah. Well, I usually give people a few minutes, but I'm gonna go ahead and start and welcome everybody today. So, this is the East Side Community Forum where we hold once a month, very casual, informal setting for folks that are doing work or interested in doing work or who live in East Charlotte to just come and connect, share resources, and share information because at Charlotte East, we believe a connected community is a stronger community. Um, so with that said, we have a pretty good agenda today. I'm going to flip it around a little bit, and John, I'll get to you second.
Okay.
But I would like to go ahead and give the opportunity to Miss Betty Jones to go ahead and talk a little bit about Lydia's Pantry at Galilee Ministries.
Oh, thank you. Thank you so much, Greg. No, about 2 years ago, uh, Lydia's Pantry was created, and it was out of the need for folks who would walk through the door looking for Nourish Up or just looking for food, and we had nothing to give them. And it's also like a stopgap gap measure when Nourish Up is closed. So what we do is we prepare food for them for at least 2 days, and then we sign them up for Nourish Up. So we work hand in hand with them so that we'll fill the need for the moment, but knowing that they need far more than that. So we work with Lynn, and her volunteers at Nourish Up, and it's a beautiful relationship. You know. And we started with a closet, and as the idea grew, we were able to move into like a storage, it's a pretty big storage room, and we had like 4 shelves, 4 racks of shelves there.
Mm.
But then the need continued to grow, and we began to get more donations. And so at this point now, we have moved into our own room with like 7 shelves that we can stock food, and not only food this time, but dignity items, from diapers to pull up for babies, adults to, feminine products and you name it, and even um, towels and toilet tissue and dish detergent and things like that. So we're still growing, but we are stocked now with those items. So when they start running low, we just reach out to the community and whomever and see if they can help us, restock our shelves. But it's been a blessing to all of us because when we have a chance to serve, and then those that walk through our doors, we do not have to turn them away ever again, as long as we have stock. And now at the end of the month, our hours are going to be expanded. So when our regular folks are not there Monday through Thursday, someone's always there, usually from about 10 to 1. But there are times when they're not there that we will start looking for volunteers that will help us out on those off hours for at least 2 hours a day, that Monday through Thursday when our regular people are not there, so that there's always someone that's manning the space to help. So we're excited, and we just want you to let your people know that we've grown and we're there and always willing to serve. And we also get donations of clothes and children's stuff, from time to time. So it's worth it to, just check out what we may have at the time. So that's pretty much it. We still have the Tower Gardens. So we also pack some vegetables in with the foods that we're giving out. And we usually try to do it for at least a 2-day period. So this is it.
Oh,
So
wonderful. Thank you so much, Betty, for sharing. And I know I think I brought this up the last meeting we had, but in our geography,
mhm,
1/3 of our residents rely on supplemental nutrition and assistance programs. So food insecurity is
ah,
one of the biggest issues that are affecting our residents. So for Galilee, for you guys to have stepped up like this, in addition to what's at Nourish Up, I mean, this is just phenomenal.
yes. Thank you. Thank you. It's-
Any questions for Betty? And I'll send, and Betty, if you don't mind sending me an email when you get the chance, just with those times that you all are open. So when I
yeah.
send out the
Mhm,
follow-up minutes, we can ensure. And also,
yeah.
please, any time there is a request, if you all are running low on items, we'll make that push
Mhm.
out to the community to help donate.
Okay. All right. Thank you.
I
Thank you.
I yeah, I'd just like to say, and it's connecting to what you just said, Greg, that there's this wonderful sense of mutual support that our neighborhoods on the east side can adopt the pantry either by volunteering or dropping off. I'll ask Betty to send you, Greg, the list of what we give out so that that's what needs to be stocked. It's a pretty standard kind of thing. But so to be able to send people to help serve, but also to be able to constantly get the word out to people who need to be served.
Mhm.
It's like a circle kind of thing. But it's a good neighborhood project,
Absolutely.
to adopt, you know, stocking it. Thank you.
No, thank you. Thank you. Alrighty, well, thank you very much, Galilee team. Greatly, greatly appreciated. All right, we are gonna go ahead and switch it over to John from Alliance Health. All you, John, and just let me know when to scroll.
Absolutely. Well, good afternoon, everyone. My name is John Giampalo. I'm a community impact specialist with Alliance Health, and I wanted to share with everyone today an initiative that's been going on and is scheduled to expand into North Carolina within all 100 counties. So this includes certainly Mecklenburg County. So it's exciting stuff. So I just wanted to kind of let you know it's called Healthy Opportunities, and there is a correlation with NC Care 360, which is a resource tool for making connections, which has relevance to that. So, Greg, you can go into that right there when introducing. So, let me tell you a little bit about this pilot. You may have heard of it, you may not have heard of it, but I encourage you to explore it further. I do have some links that you can, learn more about this, but it is a pilot that's been in existence for at least the last 3 to 4 years, and its plan is to improve the health outcomes and reduce costs by providing 29 non-medical services across 4 domains, uh, which include housing, food transportation, interpersonal safety, toxic stress, and it's going to be it's currently in 3 regions in the state, serving 33 counties. But like I said, is going to be expanding. It is right now the domains again, like I said, we're housing, food, transportation, and interpersonal safety and toxic stress. It's going to be for the Medicaid population. I will say this, I do not have any information or updates on whether or not this has any impact by the federal level. We have been told it has not, but again, I just say that with a grain of salt that we're expecting this is going to be moving forward through expansion, which we expect in the next probably 2 years. So it's important that we are aware of this now so organizations can be timely with this. And I'll get into that in just a second. But right now, there's 3 geographic areas, like I said, of 33 counties that are managing this: Impact Health, Access East, and Community Care of the Lower Cape. And again, it is for qualified Medicaid members with qualifying health and social needs. You can scroll up there, Greg. So It's going to be dedicated to, ensuring that individuals get services on a timely basis. So again, those areas that I mentioned, it's an opportunity for organizations called human service organizations, also known as community-based organizations, to actually have an opportunity to access Medicaid funding. So when you think about our food pantries, you think about um, organizations that serve these areas, as I've mentioned, around housing, which could be housing, rent assistance, eviction support, utility assistance, all those things are connected with this initiative. So we at Alliance have been we've been very much involved with this because the MCO, which we are, Managed Care Organization, and the others are involved with this initiative, not just for our Medicaid population, but also for all the Medicaid population across the state. So it's not just the managed care organization. So we are having a roundtable meeting on April 10th for community-based organizations to attend, to learn more about this, and also kind of understand what are the next steps. But I kind of want to, wet your taste buds a little bit about the initiative because it's really been successful in helping people meet their needs. Now, Greg, you can scroll up to the map here and you can see where the current pilot regions are. And you can see that Mecklenburg County is not part of it. And the reason for that is that the state, the Division of Health and Human Services, and CMS, Center for Medicaid Services, decided to start with more rural-based counties. You can see the western counties, the lower south counties in the green, and then the yellow. So these are the areas that they're functioning right now. And you can see the names that correlate to each of those areas. Those are the managing partners that kind of run it with the efforts of others like human service organizations, managed care organizations, standard plans, which are the Medicaid plans. So there's a lot of people in the mix to make this work. So again, you probably haven't heard about it because it's not in Mecklenburg, but it's coming our way. You can scroll up there, Greg. So again, the eligibility is that individuals would have to have a co-occurring physical and behavioral health and social needs. So it's not going to be just for every Medicaid recipient, but they'd have to meet those criteria. They also must live in a pilot region. Right now, of course, we know that our individuals do not. They can be food insecure, adults having two or more qualifying chronic conditions, children 0 to 20 with 3 or more categories of adverse childhood experience, which is also known as your ACE, if you ever heard of the ACE study. So again, there's eligibility, but it has a lot of impact. And also, like I said, allows human service organizations like food banks and all that kind of stuff to have an opportunity to have funding through Medicaid to deliver these services. So you can scroll down again, Greg. So the enrollment criteria would be, of course, that you'd have to be in one of these areas. We know that's hopefully coming our way. So we're just gonna have to kind of be aware of that. There's gonna be a network lead assigned to these other areas that right now does not exist because it hasn't been identified yet. The other last thing is this onboarding of something called NC Care 360. You may have heard of it. You may have also heard of Find Help. And these are two big resource tools that are utilized in our area and across the state. NC Care 360 is a platform that's considered a closed loop referral system. It is something that been identified by the Department of Health and Human Services to be the resource tool to making the connections, meaning that folks that are on this platform, as far as these community-based organizations, they'll have to be a part of NC Care 360. That's how they're going to get paid. That's how they're going to make their referrals. So that kind of rolls us into here in just a minute, so we can keep rolling. This is just some hyperlinks. Greg, if you don't mind, you can send out a PDF of this to everybody. That way they can have these links. You can do a little bit more deeper dive or contact me separately. I'd be more than happy to offer more assistance. If you keep rolling here, just a very, very brief overview of the NC Care 360 that I just mentioned. It's going to be using care managers that are going to make these referrals to get individuals these services. So like I said before, it's a whole host of individuals involved to making sure individuals get the services they need. So that's going to be the platform, and you can scroll down. People would have to join NCCare 360. It's not, we are really encouraging organizations to join now simply because that way they're more proficient with the system when it does come time for launch. There's a lot to learn. I'm one of the trainers for NCCare 360. You can certainly coordinate a training if you'd like that to learn more about this platform. We use a demo site for the training, so it could be instrumental in understanding how it works. So those are just some of the links on how you can become a part of the platform. There's no cost involved, but it again gives you an opportunity to get referrals and send referrals. So it's a whole closed loop referral system. It's an exciting thing. There's a lot to learn with it. I'll assure you that. You can keep scrolling. I think that's it. I wanted to be conscious of time.
John,
My,
I'm
yeah.
sorry, about how many partners already exist, people that are like referral well, I guess people who referral providers in Mecklenburg County already, like how many people are
With
receiving?
NCCare 360, I'll be honest with you, Greg, I do not have that data to tell you the exact number. I will tell you that it's a good number because of the work that we do and I specifically do with social determinants of health. I don't have a specific, I can research that for you to see how many are on the platform. But what I've come to realize in my work by going out in the community and meeting with organizations that may qualify, many do not know about it. It's just because they just are unaware. It's maybe something they didn't realize existed or what have you. But again, we're here to help educate, support that too, because we know that it's going to be to their advantage once NCCare 3, once this initiative HOP, as we call it, expands, they're going to have to be on it if they're going to want to, access those funds through Medicaid.
Wonderful.
And the last slide is my contact information. Certainly reach out to me. I'd love to talk to you more about it. I know, just want to be conscious of time, but at the same time, certainly can set up time for training on the platform, or if you know of any community-based organizations that may fit this mold, let me point them in my direction so I can help educate them about this.
Absolutely. And we do have Yolanda, I see that you have a question. Feel free to go ahead.
Good afternoon. I did just want to mention regarding NC Care 360. It has been around in North Carolina for several years, and there has been a push to get different community organizations on this platform. Some of you may remember the Aunt Bertha platform. So it's similar to that, but it's much more advanced in the way that you're able to send and receive the referrals and to get the referral information back and follow up on your referrals. So it's been, slow rolling for several years. But I believe in the future, especially as more organizations are a part of NC Care 360, different organizations will love the way that they're going to get these referrals. And it's just a nice way to be able to connect our community, individuals that we're caring for, to the care that they need in a seamless process. So I just wanted to put that in there. It has been around for a while. It's just been slow going, getting individuals on and trained.
And and thank you, Lana. It is a little slow moving. It has been around, absolutely. I know that the data dump that they utilized was 211 to develop the base of the platform, but it is still, even though there might be organizations in the platform, they may not be in network because they have to go through steps to become in network. So again, there's in-network providers and out-of-network providers on the platform, but the success would be trying to get as many of our organizations on the platform as it can. As Yolanda mentioned, it's an excellent tool. It is sophisticated. It is a closed loop referral system. So there's accountability on both sides to make sure people get the help they need.
Wonderful. Thank you. Any other questions for John before we move on?
Thanks, Greg, appreciate it.
No, thank you, John. Thank you for taking the time to come talk about this today. And I'll send the link to this presentation when I send the follow-up. Alrighty, y'all. Well, the next agenda item is something I'm actually super excited to share, and I've meant to share it the past two meetings, but we kept running out of time. Is something that we've put together over at Charlotte East that is, let me pull it up. Calling it the, right now, the Greater Eastland Asset Map, right? So not to get crazy in the weeds with, the geography and how we came up with the specific geography, but, obviously with the introduction of the new development at Eastland, folks are starting to look and carve up parts of town in different ways. So we saw the need to start calling the specific heart of East Charlotte, start using the term Eastland again in reference to it, largely because when we have visitors that are going to be coming to that site, they're going to be searching for things to do around Eastland, not in East Charlotte specific. But I say this all to say, I've shown this to this group before, but this is the core geography that Charlotte East really focuses on. It is bordered by Eastway, even though we have this little carve out right here that includes Galilee, the Plaza, W.T. Harris, and Independence, right? So roughly 70,000 residents. But what we've done is because folks continuously ask, like, who is doing the work in this area? What is there to do in this area? What are the amenities? So forth and so forth. So we've created what is an asset map for our community. This is online. I'm going to share it when we send out the minutes, but have different categories of things that are going on over here. So active recreational amenities in this geography, in our footprint. So think about this. This is a 15 square mile area with the Eastland redevelopment really at the center. We went and populated all the different recreational amenities, not just including park and rec, but including like the British Swim School at Aldersgate, future projects like the Eastland Redevelopment Park, the Simmons YMCA, the Shannon Park Swim Club, neighborhood parks, the Kilbourne DIY skate park, which took the place of the old Kilbourne Park tennis courts. We have all of our CMS schools in the footprint that are linked and available for contact. The next we have, and we're working on this one, but the entertainment and event venues. Our business district, which is I think I've shared with this group before, but we're rolling out Charlotte East is in the process of formalizing a collective business / merchants association over the next 2 years to really organize and galvanize our small business community. It's something that we've been missing for a long time. It's something that Charlotte East really took the lead on years ago, but never formalized into a solidified group. We have, and these last two categories will be really specifically, I think the folks on this call will appreciate this. And again, this is not an exhaustive list. These are just the folks that we either have direct partnerships with or folks who have referred these organizations or these communities to us. So the different houses of worship that exist in our geography. And many of you are on this, the nonprofits and social services, right? So this one was the one that we curated. So let's go over here, let's zoom in, click on Galilee Ministries right there. We have the description of what Galilee does, have the link directly to it. We're not putting contact information besides just the website, but then we have the scrolling list right here that we ultimately hope will be able to categorize by service area. What that's youth, child development, if it's health. We've included future projects that are not open yet that we feel like the community really should know about because they're going to be pretty massive. Wait, this is the Latin American Coalition. Let me go to the Kate Blessing Center. Okay. So the Kate Blessing Center is, if those of you aren't familiar, it's going to be a massive, if you've already passed Central Avenue, it's on the other side of the street as Eastland, but North Carolina's largest inpatient youth behavioral health center. I mean, this was a $75 million project. Their groundbreaking ceremony is going to be next month. A good number of jobs, but it does both inpatient and outpatient. So there's information for here to know about it. Let me give you another example of one that isn't on the radar. Let me not change that map. One that isn't open yet, but we feel like folks should be aware of is the Umbrella Center, right? So I don't know how many of y'all know. The Umbrella Center is going to be a public-private facility for folks that are survivors of domestic violence. That's going to be opening across from the Eastway Park, Sheffield Park neighborhood, right really after you get off the Independence ramp. So I'm not going to go over each individual thing that we have on here, but this is all curated by us. Like, we decided to sit down and say, hey, there's a need for this, to put these different categories of things together, because especially as we get more visitors to our side of town, and people that, you know, how many calls I get talking about folks that want to create, they want funding for X, Y, and Z nonprofit. They want funding for, you know, X, Y, and Z grant to do a facade improvement for their business. We thought that we needed a central location to send people to say, hey, please look and see what already exists before you come in and start trying to duplicate services. Because we see that way too much in the grant pools, the federal pools, county pools, and the city pools. They're drying up. So, you know, we wanted to make sure that this was here and present. And I mean, it's constantly going to be a living document. So if there are new people who come on board, when I send this out to you guys tomorrow, if you notice that there's an agency missing, feel free to please send it to us. Like, we have the Honduran consulate, you know, we're on here, but we're trying to be very thorough. Any questions about this or comments at this point? Alrighty. I will make sure that we send this out tomorrow. Cool. A few more items. Oh, and then ultimately too, I didn't bring this up, but ultimately the goal, you know, we're going through the process right now of, in each one of these unique commercial business nodes that we've identified, over the next 2 months, we're going to create a comprehensive business inventory. So folks will be able to go to our website and see all the businesses, professional services, retail that exist in our geography. We're contracting out to a consultant to do this work over a 2-month period. So anticipate to have a pretty thorough list of what industries are operating in our space. And ultimately too, having a comprehensive list of the neighborhood contacts, because while the city does keep that, you know, it's very hard for the city to manage the whole city. I think with our little bit of a geography, we can manage it for us. So cool. A few more items I would like to share. So I'm super excited about this too. So Charlotte Eastland, Our Bridge for Kids. I'm sorry, Diego, go ahead.
Hey, how you doing? Can you hear me?
Yeah.
Okay. Is Methodist Hickory Grove Church included in your area?
You talking about the Hickory Grove Baptist or Methodist?
Methodist.
I do not.
Oh, the intake forms. Yeah.
I will go back and look tomorrow, make sure.
Yeah, because they have a lot of activities for the Hispanic community,
Okay.
and I can give you the contact
Please do
if you need
that.
it.
Please do that. Thank you. Because that's what we want. We want this to be a community curated map as well, that we can rely on trusted partners such as you, Diego, that we trust to say, hey, include these folks on the map, right? So thank you. Why did I'm sorry guys, I'm a little bit out of order here. So the Ethiopian Evangelical Church on Central Avenue has asked me to share this, and this is just a quick item, but starting last month, they've been hosting free ESL classes specifically for folks who need support from that Ethiopian community. And the church is right there off Central Avenue. So I will send these flyers out. And this is what I was getting at a moment ago, y'all. We're excited to partner with Our Bridge for Kids, who's like one of our strategic partners at Charlotte East that we do a lot of work with, to do quarterly resource fairs in apartment complexes that we've identified that have been historically underserved on our part of town, or where our folks come from that we see like have some of the highest need, both looking at, quality of life data, but also anecdotal and talking to people on the ground. So our bridge and Charlotte East have identified Rosecroft for quarter 1, which, if you guys aren't familiar, Rosecroft is on W.T. Harris right across from Easttown Market. We're doing Sailboat Bay quarter 2, Spanish Quarter Circle Apartments behind Captain D's on Sharon Amity quarter 3, and then Country Club Apartments off of Eastway in quarter 4. But the idea is, as our bridge and Charlotte East have really been tasked and funded by the United Way to connect the residents in our geography with programs and direct services to improve social determinants of health. It's difficult to reach folks who need things the most when we're just asking them to come to a central location every time we offer something. So what we wanted to do was go meet people at their doorstep, in addition to bringing resources that tell them where to go, right? So next Thursday, we're hosting our first quarterly pop-up with all of the agencies that you can see listed below. I don't think Commonwealth Charlotte's actually going to be there. I need to take that off. But Despierta, The Bulb to bring food, Charlotte Center for Legal Advocacy, Amity Medical, to bring, health resources and information, Atrium Mental Health Services, Charlotte Eagles are going to bring information about youth programming and activity. But the idea, again, is meeting people directly at their front door and partnering with the complex owners to ensure that the information about this small little pop-up fairs gets to their tenants. So when our next resource fair is going to be in June, like I said, in Country Club Heights, I'll put it on our agenda for this group in May. So if there's any agency that wants to come out and bring a resource, we'd love to have y'all. This is our first one, so we're piloting it with a small group to see how it goes. But anyway, wanted to make folks aware that we're going to be really targeting and involving and supporting our apartment complexes more, because traditionally Charlotte East as the entity has only focused on, single family home residential neighborhoods and homeowners. And that doesn't work. We gotta do better. So any questions about these resource fairs? Yes, Diego.
I've learned.
Yeah, we have digital navigators, and if you go to Sailboat, please let me know.
Okay, cool.
These are role playing.
Cool. We'll make sure that we have that for June.
Greg, will you be sending this out, I would imagine?
Yeah.
In your follow-up?
Yep. Have it scheduled to go out tomorrow. Yes, sir. All right, last thing for me, and then we have about 10 minutes left for open discussion, is Charlotte East is doing our first Central Avenue cleanup this Saturday from 10 to noon. Last time I checked, it looks like it's going to be a pretty nice morning. But we've adopted Central Avenue through the Keep Charlotte Beautiful program for, I think, like 5 years. We do 3 annual cleanups. It's a really fun morning. Come out, get yourself some coffee or a pastry. You can check out Manolo's is expanding pretty significantly in hopes to open by May with their new part of the building, but they're already open with their stuff that they're already doing now. It's not like they've closed down. But anyway, I say that to say we always have a really good time. Remember last spring, Diego came out, helped us pass out cake to people driving in their cars that were caught up in construction. So we always have a good time. It's a really low-key community event. I think the most we've ever had before folks come out was like 45. And then another time we had 3. So it doesn't matter either way. I think we already have like 20 people registered for Saturday, but the more the merrier. We supply the bags, the gloves, the trash pickers, but we go from Norland all the way to Eastland on Central, and spend 2 hours, and feel free to come out if you're around. Alrighty, I will go ahead and open it up to anybody that would like to share anything going on in their communities or any questions, any points you guys would like to lift. Oh, there's no way we're getting out of here 10 minutes early, y'all. Nobody? Wow.
Hey guys, this is Matt Cusack, Edified Church. Actually, first time on the call, so
Welcome, Matt. Thanks for joining.
thank you. I get the invites every month, and then I forget. So, but thank you for having me. April 5th, our church is looking to do a community service event in the area. So if you know of any place that could use some painting, uplifting, just trash pickup, yard work, feel free to contact me. I'd love to see if we can help out in any way. So just want to throw that out there.
Thank you, Matt. Do you mind sending me a note about that?
Absolutely. I could definitely send it to you.
Thank you. I appreciate that.
No problem.
Alrighty. Anybody else want to lift anything up? Alrighty. Wonderful. Thank you all for joining. Thank you guys thank you, Betty and John, for sharing today. And you all have a wonderful rest of your week.
Thank you. You too.